سيداتي سادتي، السلام عليكم ورحمة الله وبركاته. نحييكم اليوم 25 من شهر أغسطس سنة 2020، ونتمنى لكم مشاهدة ممتعة في أولى حلقات هذه القناة. هذه القناة عبارة عن قناة لطب الطيران، تتحدث عن سيكولوجية الطيران، الأخطاء التي تحدث في قمرة القيادة، والمواضيع العديدة في هذا الشأن. هي قناة تثقيفية وتعليمية بالدرجة الأولى، ونتطرق إلى أهم المواضيع التي تهم المشاهدين المهتمين بشؤون الطيران. حقيقة القناة هي نوار الجهود المثمرة التي قامت بها جمعية الطيارين بالمملكة العربية السعودية، على رأسها سعادة الكابتن عبد العزيز الخياط، ونائبه اللواء محمد الجهني، سعادة اللواء محمد الجهني، وكذلك الأمين العام للجمعية سعادة الكابتن باسم فلاتة. في هذه الحلقة اليوم سنناقش المسؤولية القانونية المترتبة على علاج مريض على متن طائرة على ارتفاع 38,000 قدم. هناك تبعيات قانونية لعلاج هذا المريض، وهذا الموضوع يهم بالدرجة الأولى الأطباء الذين يسافرون كثيرا ودائما ما يسمعون إلى نداء دكتور أون بورد. نتمنى لكم مشاهدة ممتعة، وننتقل الآن إلى الشرائح المرئية.
نبتدي الآن باستعراض الشرائح. نتحدث عن المسؤولية والتبعات القانونية لعلاج مريض على متن رحلة على ارتفاع 38,000 قدم. Actually, the legislator, he left the door half open and half closed, so they can sue you and they can let go of you. In this presentation, I'm trying to tell you how to be safe as much as possible. We take a closer statistics here. There are about 5,000 aircraft in the sky at any given time, and there is 9.7 million scheduled flights, and there is 15 to 100 in-flight medical emergency per 1 million passengers annually. There is 2.7 billion travelers worldwide annually. Of all these flights, there is in 80% of these flights, there is a medical practitioner on board. A medical practitioner can be a professional physician or a professional nurse or a paramedics with a good knowledge in medical backgrounds. Now, the prevalence in the year 2000, as per British Airways, there is one in-flight medical emergency per 1,400 passengers, and in 14,000 medical emergency, one case required professional medical intervention. There are 44,000 medical emergency worldwide, and there is 0.1 death per 1 million in-flight medical emergencies. Now we go to the Aviation Medical Assistant Act 1998 of United States of America, which is a subject of debate. The act says the bona fide medical practitioner is held harmless by the law even if negligent, provided he is not guilty of aggravated negligence. So we have negligence and aggravated negligence. Now, it does not apply to physician or medical practitioner who acts spontaneously. You have to ask the permission of flight attendant to take an action or to intervene. For example, if you have a passenger sitting next to you and he's eating and he choked, you have to take permission before you do any maneuver, Heimlich maneuver, or if you want to go for tracheostomy, it's your call. But you have to ask permission first. The Aviation Medical Assistant Act is not working in Louisiana, Minnesota, and Vermont. These states does not implement this law. The question is, acting outside medical competence is aggravated negligence? Well, in many lawsuits, aggravated negligence is defined as taking unreasonable, unnecessarily unjustified medical risk. For example, if you want to insert a central subclavian line, then you chose to take the left side. Now you're taking unnecessary risk because you know that on the left side, the lung, the left lung pops superiorly on the left side. So you have to choose the right side. It is better. It's much more safer. I think you should take. The point is the medial 2/3 and lateral 1/3 of the clavicle. You get your point. You insert your line, but you have to also be careful of the thoracic duct, which ends at the junction between the left subclavian and left internal jugular vein. Now, O.J. Brown Simpson, a very famous American footballer, in June 12, 1994, he killed his wife, Nicole Simpson, and her friend, Ron Goldman. Her blood and her DNA, the DNA of OJ also was found in the gloves. The blood was found in his truck, the murder weapon, everything. He was completely firm. He was stalking on her. He was sending threat messages to her, yet he was able to walk free. And this is, in my opinion, one of the most shameful uh, lawsuit case in the United States of America. And he was able to go free by the help of Johnny Cochran, the famous luxurious lawyer. Now, the Warsaw Convention was established in 1923. Then it was again amendment in 1925, 1929. Then it was called the Hague of Netherlands Protocol. Then in 1971, the Guatemala Agreement or Protocol. Whatsoever, the Warsaw Convention is a unification of international law and rules which govern the transportation of passenger luggage and goods. Uh, and the Good Samaritan law is part of this convention. Now we have to define a very important definition. Incompetence means that the person does not possess the knowledge or the skill to perform a given task. It does not mean that this person is not intelligent or he is habitually careless. It is situational and it is job related. But negligence is a person is competent to perform this task, but he give or he deliver the wrong care. Now, a negligent physician can be a very good doctor, but he fails to take the necessarily precaution and care which is taken by the ordinary person in a similar circumstances. It is related to the act of careless mistake and inattention. For example of negligence, if you want to insert also a central line, say for example in the internal jugular, you will find the cricoid process, the medial border of sternocleidomastoids. You will go half inches below the skin. You will find the vein. You go all the way down to the superior vena cava, and you reach the right atrium. You insert, then you close, you stitch your line, and then you connect the patient to the hemofiltration or hemodialysis machine. But you forgot, and then take your coffee, and you go home. But you forgot a very important thing to do, which is chest x-ray, because you might have given this patient a pneumothorax. So this is an aggravated negligence. Doctor duty of care. All of us as physicians, we have duty to care towards our society and community, towards our patients. Therefore, some of the jurisdiction will sue the doctors who will not respond to their patients' duty. The Hippocratic Oath also says to do no harm, and there is also the tort law, tort coming from a Latin words which is torture, means harm. Now, in-flight medical emergencies, syncope or near syncope is 37.4%, respiratory symptoms 12.1, cardiac symptoms 7.7, seizures 5.8, abdominal pain 4.1, infectious disease 2.8, agitation or psychotic symptoms 2.4, allergic reaction. This is very important. It always happens in the aircraft when they eat different food which is available, like seafood or nuts. Possibly stroke 2%, trauma 1.8, diabetic complication 1.6, headache 1%. Headache is a very important symptoms in the aircraft. You have to differentiate, are you treating simple headache or treating thunderclap headache or migraneous headache? It can be due to intracerebral hemorrhage or a thrombus dislodging in somewhere in the brain, transverse fossa or any other place. Cardiac arrest 0.3%. Now, diversion means changing the original route of destination. The most common cause of diversion of aircraft is weather and technical, fuel problem, shutdown of fuel pumps, traffic like military operation area or controlled area, and finally medical emergencies is also an important cause of diversion. Now, estimated diversion times 30 to 45 minutes non-ETOPS. ETOPS mean extended to engine operating procedures. We know that the 777, for example, has two engines and it has to cross the position with two engines. So if one engine goes failure, the aircraft has to divert within 40 minutes to the nearest airports. So they flew actually a route called ETOPS. Now, from January 2008 to October 31st, 2010, there was about 12,000 in-flight medical emergencies, 7.3 diverted from its normal route. The cost of diversion is 300 to 400,000 dollars, US dollars. Uh, Diversion may be faced by landing difficulties, weather. You can have very bad weather. You can have traffic in the area. You have to take priority for landing. Keep the other airliner on hold until you touch down. You have to dump fuel and you have to go down with the minimum weight. The problem of minimum weight can cause minimum weight of landing can cause hard landing, which may cause damage to the fuselage structure of the aircraft. So sometimes the diversion will end up by spending 1 or 2 days in the different location. Also, the facilities in the airport. Do you have a visual runway or instrument landing system runway? Do you have short runway? Aircraft scheduling capacity. Some other people at the end of the other station, they are waiting for this aircraft to go back to their destination. This will affect the credibility, trustworthy, and brand name of the airlines. Another important thing of diversion is the crew and cockpit. They have legality time, which means that if they pass their legality time, they are not the aircraft and the crew are not covered anymore by insurance. So if there is an air accident, the insurance company will not pay for this crossing the legality time. The passengers also, they have connecting flights, they have meeting to attend, they have family occasions, and so many things is related to diversion. Now, the lethal cocktail of those flying, actually the progressive increase in the number of traveler. We have 2.7 billions annually, which mean increase in the number of elderly people who have chronic diseases. Some of the people, they are coming by train or buses to the airport vicinity to take the aircraft. There is long queues in front of the counters. The security check-up in some airports, like JFK, the security will take about 2 to 3 hours. The passport and immigration, the delays. This is a lethal cocktail for elder passengers with chronic disease and may decrease their physical fitness to fly. Now, the aircraft, any flight, is a multinational. Uh, like it has passengers from everywhere. If you have aircraft departing from Oscar Echo Juliet November, which is Jeddah, to Echo Kilo Charlie Hotel, which is Denmark, Kastrup Airport. The flag carrier is British Airways. Flag carriers mean that the carrier enjoy the privileges of the government preferences. You have a physician from Nigeria and the patient is from France, the plaintiff from United States. So where is the lawsuit will take place? The lawsuit or jurisdiction will be in Saudi Arabia or Denmark or UK or whatsoever. This is very important for you to know that the lawsuit will take place in wherever the plaintiff will raise the case is going to take place there, and the regulation in that country it will be the regulation which is implemented to this case. We gave an example of a Nigerian physician treated ill passenger from France, and he connected the AED, automated external defibrillator, and the AED says to defibrillate. It is broad complex ventricular tachycardia, and instead the physician give verapamil, which cause negative chronotropic effects on the myocardial muscle, and the patient arrested immediately and died in the spot, and the wife raised again case against the airline. Now, on paging, doctor on board always respond. Some of the jurisdiction will sue physicians who are not responding to the call of duty. Always remember difficulties in the treating patient in the sky. Remember that you are 38,000 feet. There is a very high altitude, low pressure, dry cabin, noise of the engine, which is make it difficult for you to use your stethoscope, continuously expanding volumes because of the boils low, no enough medical tools or equipment, no enough space also for you to treat this patient. So usually act safely, professionally, and do not condemn yourself. Means do not say, I think this is acute MI, or I think this is a heart attack, or I think this is acute pancreatitis or appendicitis. Do not condemn yourself by saying these things because it will be taken against you in the court of law. Now, if one or more physicians appear in the sites of treating the ill passenger, please step back immediately because this is because of the different schooling system, different patient counseling, different patient approach in different medical schools. Yes, medicine is one, but the different approaches in treating patients, we noticed that from accumulated experience that if you have a doctor from this college or a doctor from this college or a doctor with this experience for abdominal pain, he will tell you no, better put hot compressors, or somebody wants to give Hyoscine, the other one will tell you no, don't we give the Hyoscine, it will mask the symptoms of appendicitis, you just give the diclofenac. So, different experience, different knowledge, different accumulated experience. So you better step back. You are going to enjoy your vacation. You don't want a conflict in medical practice. Now, do not take history from the patient unless you decide to treat the patient. There is a law which is called Patient-Doctor Relation Act. This law is under also medico-legal liabilities. If you start to take the history from the patient, what's your name, what's your age, do you have kids whatsoever, do you have, so it means that you build up a relation between you and the patient, and this will take you immediately under the liabilities of Patient-Doctor Relation Act. Show your ID, make sure that you have a valid ID. Showing expired or treating a patient with expired or invalid ID will expose you to medico-legal liabilities. Check vitals and general conditions of the patient. Now figure out, relate, correlate, and articulate. You have to take one of two decisions, either immediate descent and diversion or stabilize the patient. Now, for example, if you have a 58 years old passenger with chest pain, sweating, cold extremities, and you have 18 years old female heavy smoker, both with chest pain, for sure the first one you will diagnose acute MI or heart attack. In the second one you will diagnose the ruptured bulla. So in the ruptured bulla case, are you willing to insert chest tube and do underwater seal? It depends. It's your call. So you have to think very carefully if you will take the underwater seal or if you will ask the pilot to divert immediately. In the first case of the 58 years old, you can give it a trial of Izordil sublingual 15 liter oxygen per minute. You can give some sedation. You have sedation in the doctor emergency kit. You can give also nitroderm patch. You try to relax the patient and see if the patient will stabilize. Otherwise, take the decision of descent. Diversion is the rule. So do not put burden on yourself. Do not put unnecessarily burden on yourself and on your knowledge. Diversion is the rule. Otherwise, you will open the hell door of liabilities, incompetence, negligence, misconduct, and criminal act. So it's very important for you to take a wise decision and you know your competence and limitation. Now make sure that the patient consented to your treatment. Make sure the patient will sign. There is a form in the doctor emergency kit called the consent. The patient has to sign that he consented you to treat his case. Also fill up all the documents, fill up the history, the complaint, the findings, the medication you gave, the time given, and progress. Do not stick to yourself to a firm diagnosis like acute appendicitis. No, you can put abdominal pain for unknown etiology or chest pain of unknown etiology. This will save you a lot in the court of law in case of any future a lawsuit. Now, the medico-legal liability is based on the aviation practice of Warsaw Convention. There are three parties which are involved in any medico-legal lawsuit case. The first party is the carrier, which is the airline. The second party is the Good Samaritan, and the third party is the plaintiff. The first medico-legal liability on the carrier, trained cabin crew. The carrier should have a trained cabin crew. Trained cabin crew means they are able or capable of identifying emergencies on board. Like if they see somebody with anxious passenger with chest pain, sweating, cold extremities. So this is a case should be identified. The second medico-legal liability on the carrier is call for help. They should page for a doctor on board. Then the third of medico-legal liabilities on the carrier is lack of medical equipment on board. In the aircraft, there are two equipments which are no-go items. No-go items means that the aircraft cannot depart without these two items on board. This is the AED, automated external defibrillator, and the doctor emergency kits. Now, the doctor emergency kits cannot be opened, as the name implies, unless the doctor is opening it, but cannot be opened by any other individual on board. There is also the first aid kit, which can be opened by any flight attendants or any passengers or paramedics. And there is the universal biohazard kit. This one contains powder which act as adsorbents for the patient's secretions. If the patient is having diarrhea or vomiting or any other secretions, they will spread this powder on the secretions, then it will be absorbed, and then they will just collect it and throw it in a special biohazard bag. Some of the airlines, they created recently the CDK, continuous biohazard kit, or CDK, contiguous disease kit. This is created during H1N1, SARS-2, and it has gloves, masks, gowns, head caps, all these things in the CDK. Another medical legal liabilities on the carrier is failure to check that the ID of the medical practitioner, that it's bona fide. Bona fide means certified licensed physician. It is the responsibility of the air crew to check the ID and then to permit the Good Samaritan or the physician to proceed for the patient treatment. This is because some of individual, for no reason, they will appear and they will pretend that they are a doctor, and it happened in many times in our practical history. The fifth medical legal liability on the carrier is failure to divert. Because after assessing the case by the physician or medical doctor on board, one decision has to be taken by the Good Samaritan, whether he is going to treat and stabilize the case, or he preferred that the aircraft should divert. So if the Good Samaritan asked the pilot in command, you need to divert, this is a heart attack or this is a serious condition, then the pilot in command has to divert to the nearest airport. The sixth medical legal liability on the carrier is lack of medical records, patient consent. All flight medical records, including treatment measures taken to stabilize or to treat the passenger, together with the course progression of the illness, should be completed, signed by the doctor on board, and handed to the supervisor, who will keep them in a safe place for any upcoming investigation if there is any lawsuit case. Now, the Good Samaritan potential medical liabilities is the duty of care. Some of the, as I said, international jurisdiction will sue the physician if he will not respond. Some, they don't care. But if there is a patient-doctor relationship before, then there is a liability on the doctor on board to treat this patient if he knows him from before, even if he wrote him before one single prescription in the past. So he has to go and treat this passenger. But the safest thing to do is to show up and to respond to the duty. Now, the second liability is reckless misconduct and negligence. If the case requires diversion, then the doctor on board should ask for immediate direction. Otherwise, he will be sued for reckless misconduct qualification. The liability of qualification depends if the doctor case falls under his specialty. Like if I'm orthopedic and I'm treating a cardiac case, then I will find some difficulties in treating the case. I should inform the pilot that this is not my specialty and he has to divert. Otherwise, I will be subject for medical legal liability. Now, on the plaintiff or the ill passenger has also medical legal liability. The plaintiff or the passenger has to fill up what we call a medical information form. If the passenger has a pre-existing medical condition like ischemic cardiomyopathy or seizure or epilepsy or psychotic or any other type of medical condition, they should fill up the medical information form. We call it MEDIF or MEDA, should be signed by their treating physician and as fit to fly as a passenger. Now, the other liability which falls on the passenger is the burden of proof. The passenger or the plaintiff has to the burden of proof of any of the items that come under the carrier medical legal liability or under the treating physician medical legal liability. Now, the burden of proof in medical cases is lower than in criminal cases. Criminal cases usually require guilt beyond reasonable doubt, but in case of medical problems, if the jury find that the physician is only 50% wrong, then he will receive a verdict, guilty verdicts. Like for example, leg pain can be DVT, but if the passenger arrived to destination safely and he was treated against DVT, so everything is fine. But if this DVT was complicated by pulmonary embolism, then there is a case. And the case from the very beginning, it is leg pain and there is a possibility of DVT. So this is a 50% mistake from the physician and can be easily proved that this was a DVT and it was complicated by pulmonary embolism, also chest pain for GERD, which later be proved to be acute heart attack, or gastroenteritis for ruptured appendix, and this also can be a case.
مرة أخرى نحييكم ونتمنى أن تكون هذه الشرائح والشرح قد حاز على إعجابكم، ونلتقي قريبا إن شاء الله في حلقة جديدة في مواضيع أخرى. أرجو أن تستمتعوا بهذه القناة، وأرجو أن تشاركونا بسبسكرايب ولايك حتى نوافيكم بأهم الموضوعات الجديدة. والسلام عليكم ورحمة الله وبركاته.